Hello, everyone, and welcome to a brand new episode of Reframe Your Health. I'm Dr. Labib, and beside me is, as usual, Dr. Youssef, my co-host, and I am his co-host too. We are a team effort here. Well, we're very excited because we're recording this episode from a new space. It's a lovely space, and we're going to talk about something also new related to FemTech, or all these technologies that are out there related to women's health. And we're going to probably have several episodes about this because there's a lot of devices that are out there, and we picked today 4 or 5 of these devices, and then hopefully in the next episodes we're gonna talk about more devices. So Youssef, let's start with one of the devices that you picked and you think is
there's plenty of devices out there. That's going to start with that. We want to first tell people that we're not affiliated to any of these devices.
Exactly.
We have nothing to do with them, but we just picked them randomly. We chose a few different devices that apply to different like fertility,
breastfeeding,
bunch of stuff,
and even sexual health.
Correct. So yeah. we wanted to just basically showcase these devices that are there, present them to people. And just like how technology is starting to influence all these devices and how it's affecting women's health, whether it's at home, whether it's in the office. So a bunch of things. Most of these devices are in the fertility realm, because everybody's excited about fertility, checking when you're ovulating, checking when your peak fertility is. And then now with the improvement of technology and AI and feedback, all these devices are there. They target people to buy them, so we wanted to kind of like put them out there for our audience to take a look at them and figure them. So the first couple of devices are going to be in the fertility track and stuff because there's plenty of them.
Exactly. And fertility is unfortunately is a big problem nowadays. We're seeing a lot of infertility cases, whether it's related to men factors or female factors, but as women health experts, we want to focus on the female part.
Right.
So what is the first device we want to talk about?
So the first one that we came across is Ava. It's like a bracelet that people wear during the night. And it's pretty much like an Apple Watch, but it's round. People put it overnight. And what it does, in summary, it tracks somebody's fertility. It gives you your peak 5 days fertility during the month. And with that, people can track their fertile days, know when to have intercourse so that they boost their chance of getting pregnant.
Right. So like any device, of course, it has some pros and cons. So one of the good things about it, especially in women that have regular cycles, it will tell them those fertile days. In the past, we used to tell women, check your temperature in the morning when you wake up, and if the temperature is 0.5 degrees or 1 degree higher, it means you're ovulating. But this might be a little bit sometimes too late. So here, it's giving you more data on the fertility, more data about your sleep also. So it's not only about when you're ovulating. So this is the good thing about it.
So of course you're coming from checking your what we call it the basal body temperature. Exactly. It's got to be done with a specific thermometer that measures 0.1 degree changes. Yeah. So people have to track this and basically look at it, making sure that they're getting that peak fertility. What the Ava does, some people wear it overnight, and it tracks their change in the temperature, their heart rate, the change in the heart rate, and it also detects the perfusion of the skin, how much blood is coming to the skin. And then an algorithm puts these 4 or 5 data points together, and then it will tell you the peak 5 days. Yeah. And of course, you track them, the first, second, and third cycle, and over the course of 4 to 6 cycles, people should have a beautiful idea of when they're ovulating, when their peak 5 days are, and they'd be able to time their intercourse because we know that if somebody does have intercourse on the wrong time of the period, they might not get pregnant.
Exactly. And if you have intercourse during this period, your chance of getting having a pregnancy is around 20-25% in the ideal situation. So this is great for women that have regular cycles.
Yeah.
Unfortunately, we see a lot of women with irregular cycles, with PCOS, which is your subspecialty. So can they use this device if their period is irregular, or it's going to be a little bit more difficult?
I mean, anybody can use the device, but it's going to be much harder to interpret what's going on because, some women with PCOS can go 3-6 months without having a menstrual cycle or ovulating. So you might be wearing that device for 6 months and getting no response.
Yeah.
So it's not for everybody. It is marketed for women who have regular cycles.
Exactly. Yeah, and I see a big potential for this device because eventually you can add much more data, much more deeper data about sleep, which can be related to fertility and our overall health. So this is one of the devices that's really, very easy to put on, doesn't bother them at night, gives you good results, empowers women and couples to know, when to get pregnant.
So they know they have insights about their menstrual cycle, which obviously gives everybody insights about their general health. Yeah. And it's not invasive. Nobody has to go do a blood test or a urine test. It's very discreet. They wear
less
it at
cumbersome
night.
than other trackers from the past.
Correct.
Of course, the price. I'm not sure. How expensive is it? Is it worth it for some people to do it or not? It all depends on your preferences, on your
budgeting.
Budgeting, exactly.
Budgeting.
Exactly.
I do have the prices of the devices here, so this is
I don't think it's very expensive, but it's not cheap. So, but maybe with the data that's giving you, it might be worth it for some people. Exactly.
$279. And then there's like
on Black Fridays they make it maybe cheaper. Yeah,
probably. And then there's like there's a 6 months package where you pay extra, and then if you don't get pregnant in 6 months, then they would give you a full refund. It's
again we have to tell people we're not related or affiliated with those companies. But again, so you have to check yourself to see if this is something that will benefit you and if it's good for you. So what about the second device? I think there was a second device related to fertility too. So
the second one is a different, same purpose, different approach. It's called the Mira device, MIRA. Again, not affiliated with Mira. There's a bunch of competitors in the market.
I'm not affiliated to them, but actually they sent me like a kit to try. I haven't tried it yet on my patients, but it's a quite different device than the first one we spoke about. So tell us more about what is the Mira device.
So the Mira is it basically tracks fertility by checking the some metabolites or biomarkers in the urine. So it has to have a urine test done. So people track their urine sample, and it basically looks at a few biomarkers, whether it's the classic LH surge, which is a hormone that goes up when people are ovulating, and it also a couple of other metabolites of estrogen and progesterone. The nice thing that distinguishes this device from the regular ovulation kits that people can buy in any pharmacy, it's that it's getting a little bit more information, and in-depth information, and it syncs to an app. And it's AI also integrated, but basically the AI is gonna be able to monitor all these 3 biomarkers and give you a graph of what's going on in your cycle.
So it gives you like a quantified number of your L, not only positive or negative like the older generation test. So and this is I think good, especially for women that don't have regular cycles. So they can do it over 10-15 days a month and see if there's any changes, put it on the graph, show it to their physician, to understand more what's happening in their body. So it is maybe a little bit more cumbersome than the AVA, but it might give you, some other information in a different, patient or different situation. It's a nice test, I'm sure. And the nice thing, like I said, it's like a mini lab at home. Instead of you going to the lab to check your levels, you can do that. And, I've noticed there's a lot of companies now doing this for other hormones, for, estrogen, for cortisol. So there are many companies where it is, a urine-based test or even saliva. So saliva-based tests where they can also see their hormones at home through an app, and they don't have to go to the lab and have all this, cumbersome situation. So it's a good test. Price-wise,
price-wise, we'll look at
Yeah.
the price in a
Yeah.
second, but I think ultimately this will, as the technology advances, this will replace at some point the over-the-counter, the shelf,
Yes.
strips, the test strips, the ovulation prediction kits that we have used in the past.
Yeah.
So because it's going to be a better test, it's going to give you more metabolites, more information, and it's visual. The patients can show up and they would show you on their phone the picture of the graph, how it's been.
Yeah, I need to probably, give it to one of my patients and see how it looks. I haven't had the chance. But yeah, and the nice thing about it, it can integrate with other devices in the future. So you're tracking, your reproductive hormones, but maybe we can add to those other hormones in the future, your cortisol, maybe your thyroid test, maybe your testosterone. So eventually you'll have one device that will check all your hormones over time and, in real time too.
Yeah.
So
I was looking at the cost for the Mira. It's $150. That comes with 15 strips. So obviously people will have to buy the strips. It's not a terrible price point for the information that it's gonna give.
Yeah, this is good. So the third device, I think we're gonna shift gears from fertility. Like Dr. Youssef said, there's multiple devices or gadgets on the market for fertility, but we're gonna move to a different gadget that's I think very important too for working women that just had a baby that are breastfeeding. And I know breastfeeding is like a very difficult job. I think we have to give a huge credit to women that are breastfeeding. However, women today have careers and some of them have to go back to work. So pumping is another option. Of course, direct breastfeeding has always more advantages, but pumping is as good. And then, the pumps, I'm sure many people have seen them. They can be loud, they can be, very obvious and, cumbersome to, let's say, pump at work. You have to sit in a private room and do it. Today, there's a new pump, that can be placed in the bra and it can, pump small amounts of milk and goes into a container, and that way you can be doing it while you're working and doing other things. So this is a great device, the LV breast pump. I like the idea. I don't know what you think about it. If it's
LV's, it's been around for a few years. It's a very, very cool gadget. Because as you mentioned, women are tired when they give birth, and people don't pay attention to that factor, that women are exhausted. They just went through pregnancy, birth, and having to deal with postpartum. So the pressure of having to feed their baby, and if the baby is sleeping and they want to pump because their breasts are engorged, they go to work. Some people have to return to work after 6 weeks.
Of course.
So when they return to work and they have to pump, carrying a huge pump with you, is not ideal. And then you have to go to a special room, and so that's the advantage of LV. It's actually a very, very cool device that takes the shape of the breast. It stays under the bra and it creates the suction. There's 3 sizes, and it's for pumping on the go.
Exactly.
I would say.
Exactly.
Now, should it be the main breast pump if somebody's pumping? In my opinion, it shouldn't. Obviously, it should be on the go if you're out and you want to do that, extra pump out, or if you're really tired at night, you're trying to catch that minute of sleep, and you don't want to bring your pump, attach it to the
especially if your partner is sleeping next to you too, he's gonna hear the pump, and it's annoying. So it's a nice discreet way. Like you said, it can be like an adjunct to your main pump and to your breastfeeding, because even the containers don't have a lot of
they're small
smell. Exactly.
They're small.
And some women have big amounts of milk that's pouring, so you have to be careful with that. But yeah, it can be an option for certain people that can have it, especially working career women. I think it's a great thing. And price wise,
so
I didn't check prices of these devices, so that's why I keep asking you, but I assume it's gonna be
it's a pricey device. It's somewhere in the 500 plus 550 for 2 pumps. You can buy 1 pump, and then you have to double up the time of pumping. But the other downside of it is the pressure that this machine creates. It's going to be less than the pressure that the hospital grade
Exactly.
pumps will create. So there's always the concern is if somebody's using these devices
A lot.
constantly, then the supply would slowly start to decrease.
Yeah, and the engorgement can, kick in, and they can develop, mastitis and all of that. But again, like you said, it's just
It's a luxury.
a luxury, and just for short periods of time as an adjunct to the main, breastfeeding pump that you have.
I'll tell you from personal experience. My wife, when she was breastfeeding, she used it. She had it as the second pump. It was convenient. Her thing is that with time she used it more often, and then I think the quantity of breast milk slowly started to go down.
Yeah.
But yes, is it convenient? It's extremely convenient. Sometimes we would be out with the baby after birth, and she needed to pump, and that was a very discreet way of pumping.
Actually, now it's I just thought about it. Of course, you can sometimes express colostrum or the substance before the milk starts. Before even delivery. So maybe this device can be even used, in certain women before they have the baby, collect some of this colostrum and early milk for their babies, because it's has a lot of nutrients in it. So it can be used maybe for that purpose.
Yeah.
But
Could
this
be
is
expensive for that purpose.
Yeah. Again, it depends on people's budgeting and how their lifestyle is. But yeah, I like this device. I think
It's cool.
Yeah.
They're not the only company that makes that. There's
Right.
another company that produces portable pumps. It's an option. If at some point they're able to get the pressure to be to match the pressure of the hospital grade, I think it'd be a great replacement.
Cool. Third device.
Fourth.
Device.
We're going
Yes,
fast.
Yes. Fourth device. Something, a device that, OBGYNs or family medicine doctor use it in the clinic as part of their, pelvic exam, or if they're doing a procedure like inserting an IUD or doing a biopsy. So what is this device called? We were discussing it yesterday, and I think it's not a very new device. I've seen it out, or maybe another, similar technology a few years back. But what is the device and what's the advantage of it?
So first, I want to thank you because I've never heard of it before. Just as many crazy things that you send to me every day that I've never heard before in my life. So I want to thank you.
So that's why we need
again.
to divide those episodes into different
into what Labib teaches me every day.
No, like maybe like 5 at a time, because really they can be overwhelming. And we'd like the whoever's watching is to go over these 5 and see which ones are convenient for them and decide. But
so this device is called CareVix. It's not a device for people to use at home. It's a device for OBGYNs to use in the office that can make the patient experience better.
Exactly.
Okay. It's going to replace something called tenaculum. We don't have the picture of the tenaculum, but if somebody looks at it, it looks like a medieval torture device that we use in the office to grab the lower part of the uterus, which we call the cervix, and then we pull it in order for us to do procedures. Mostly it's going to pertain to putting an IUD in the office. Okay, so imagine you're grabbing something with 2 needles.
It's very sharp, yes.
Yeah.
So it looks like scissors with very sharp ends that will, grab the cervix. And, I'm sure has always happened to us. And, when we are, doing those procedures, sometimes that can cause bleeding where this sharp thing has gotten. Sometimes it can rip through the cervix. So it's not... And the way it looks, it's scary. So thank God most patients don't even see it. But the pelvic exam itself is not comfortable. You have a speculum in, and putting a tenaculum is going to be even more painful. I was always taught to tell patients to cough while we're putting it in so that they will be distracted. But it can be also annoying and painful. So
basically, the tenaculum is that device that we have been using, and the newer device is called CareVix. It's supposed to replace the tenaculum.
And care for the cervix, I guess. Yeah.
Exactly.
Yeah.
Replace the tenaculum so that we're able to do the job without causing pain and trauma to the patient. Okay, so the way it works, it works by creating a suction so that we're able to grab the cervix without pinching it.
Exactly.
And then be able to perform the procedure or placement ID. And the studies that they have done, in the marketing and then in the production, they say that it reduces discomfort by about 80%.
Is, I don't know if there's anything, that can do that. I mean, this is amazing. 80% less pain is great. Because you already have also the pain of inserting the IUD itself.
Correct.
So if you can take off this part, it's great. Of course, you can even put some local anesthesia in the cervix to prevent, further pains. Maybe also like pre-medicate women before the procedure, some music in the room. There's a lot of studies about music, relaxing music to lower the pain. So again, we want to try to make this experience as less comfortable as possible. The good thing about this device also, like I said, it's a suction. So once you remove it, it's not going to leave a mark or like a hole basically where the tenaculum used to go in and cause bleeding.
Right.
But sometimes it's painful to stop that bleeding. You have to put certain solutions, put some pressure. So sometimes it takes longer to stop the bleeding from the tenaculum than from the procedure. So I think it's a great device. I'm sure, it's going to take some time. I don't know if these are, disposable ones or they can be cleaned up and used. Honestly, I have to check that. And I don't know about the price either. So
Yeah, me neither. I don't know about the price. It's going to take a lot of education for the doctors because you're used to using older device for years now.
Yeah, and then the tenaculums can be, cleaned up, autoclaved, and used again. This device maybe not, I don't know, so it might be more expensive to the practice and to the patient eventually. But at least, somebody has thought about this and, thought about
this
the
is,
pain.
again, where we're heading in the future. So, one of the main points of this episode is to show people where we're heading in the technology world.
Exactly.
And, it might take a little bit of work to replace the older stuff, but it's there. It's not a device that somebody's going to walk up to, any pharmacy, grab it, take it to the doctor's office. The doctor has to have known about it, stocked it in the office, and
trained and trained and using it. And again, change is always difficult, but I think it's something to consider. Whether physicians are listening to us or any of the patients to tell their physicians about this device. Maybe they can look into it and see if it's worth having. I think it's worth having in your practice. Especially if studies have the post-marketing studies showed an 80% reduction in pain. This is amazing.
Yeah.
So from pain, IUD, let's shift to our last device.
From pain to pleasure.
To pleasure, exactly. So tell us about the last device.
So the last device, again, it has nothing to do with the office, has nothing to do with tracking fertility or breast pumping. It has to do with sexual pleasure. So it's called the Lioness vibrator. It's a smart vibrator that women can use at home at their own privacy in order to enhance their sexual wellness.
How is this done?
So it's pretty much a smart vibrator that has sensors, and it can provide biofeedback to a device. Obviously, it can be synced to an app, and it detects a few things, mostly temperature, and it can detect also the pelvic floor muscles, their response to stimulation. So, I hope this device doesn't cause problems.
More anything in technology, there's pros and cons, and sometimes a lot of technology can lead to
issues.
Yes.
Yeah.
And, sexual issues maybe, or other things that can happen. Yeah, it's a nice device, but I just don't know how it will help people with, let's say, sexual problems or sexual issues. Because this is a taboo topic wherever you go in the world. Unfortunately, we're open to talking about many things in life, but this topic has always been a taboo in all societies in the world. Some less than others.
Cause problems.
Yeah, of course, it can cause problems. People don't want to talk about it. It gives them maybe shame, but I'm seeing more people open to it. And then the sexual education in schools is very important to have for our next generation. But like I said, I don't see, because some patients have issues with, reaching orgasm or having, so where does this device help them in? If they already have an orgasm problem, is it gonna solve it? So I don't see it as a diagnostic test, maybe just as giving them more information.
It can. It's basically
yeah.
empowering, and it comes at a price, a good price tag for that information.
I'm just curious to know the price because I didn't.
I'll have to look it up. It's somewhere in the.
Yeah, but I think it's a good step forward, to actually discover more about, sexuality, about what happens during an orgasm. Maybe they could discover an issue by using this, and then reach out to specialists in the sexual, because doing sexual studies is so difficult. The major studies that we have are from years and years. So now I know many sexologists and sex experts. It's not easy to do sexual studies and dig deep into the the whole cycle of a female orgasm. But I think as days go by, we're getting more information. So maybe this device can be helpful or the beginning of more data.
It's because it's hard to standardize all these things because it's all relative. Every woman is different. They're
it's a
unique.
complex, system, that starts in the brain. Actually, it's not only a physical, blood supply issue. It starts in the brain. All these nerves from the brain. So again, I think the biggest, we used to say the biggest, G spot, what people call G spot, is the brain.
Yeah.
This is where things start. But yeah, I like the idea of it.
It comes at a price point of $230, $229.
Not
so
too bad.
For $229, you're gonna be getting information, and you'll be able to get that information and then decide what you're gonna do with it. So it's gonna tell them at what point after stimulation they could be ready for penetration, maybe.
Yeah.
Now, would that apply to real life if they're with their partner? I'm not sure.
Yeah.
It will show you on a graph, basically, how the muscles are contracting when you've reached orgasm, and then what happens next. Some people, go flat. Some people can go back and pick up again. So it's different. Now, again, as you said, I don't know what's the validity of it. What's the utility as to enhance someone's sexual wellness with their partner.
Yeah.
Because again, there's a huge subset of women that don't reach orgasm when they're having intercourse with their partner, and a lot of them do fake it, and a lot of them don't know even their full orgasm experience.
Exactly.
So this,
I'm comparing it to other devices that give us information, like the CGM or the heart rate variability. Those you see an issue and you can work on it. Here, I don't know, maybe women will discover they don't, let's say, have an orgasm, but they already probably know before the device. Right. Maybe the intensity, they can work on intensifying that with time. I don't know. I'm just thinking out loud, like how it could help. But I think it's a good step forward. I think, if you notice, all the devices have AI in them.
Yeah.
So it's kind of another smarter brain taking all this data, connecting them, giving you all the possibilities, and giving more information to people about their bodies, whether it's their breast or their fertility or sexual health, and maybe eventually all this can, like I said, place in one platform, and it will tell people what to work on to improve their sexual
overall
life. Yeah, overall life. But yeah, it's a nice device.
It's cool. I think
and I expect it to be more expensive actually than $299, but
yeah, it's not cheap.
Yeah.
For $230. If you want to sum it up, it's for somebody who's kind of is a bit nerdy about knowing what's going on in their body when they're having this sexual experience.
Yeah. And I'm trying to think what problems it can cause.
It can.
Yeah. I don't know. Like it'll be interesting to see. I hope it doesn't, but like any device,
if it does cause problems, it's not our fault. We're not affiliated.
Exactly, we're not affiliated, especially with this device. So yeah, Youssef, I think we talked about 5 cool devices. I think we're gonna have more in the next episode. And the reason we picked out those because many viewers ask about fertility problems, and some spoke about or asked about postpartum and breastfeeding. So that's why we picked those. Hopefully, in future episodes, we can talk about other things that are coming out on a weekly, daily basis. There's so many out there.
What I was thinking is I'm sure people want to know the comparison between certain fertility trackers, for example, and for them to choose which one is best, that fits their budget, that fits their need. So that could be a cool thing.
Yeah. Just check out those devices. Go to their website. Look at the videos. Put the pros and cons and see which one is best for you, and take it from there. Some of them might not be useful for this couple, and some of them can be. Talk to your physicians, talk to your fertility doctors, and see which one they would advise you to do. And then again, these do not replace clinic visits, ultrasound monitoring, and sometimes lab testing that should be done in certain situations. But it's they're
an adjunct.
They're cool. They're cool devices.
They're cool devices. Awesome.
Yes. So
I think with this we're going to conclude today's episode. We'd like to keep them short, concise, fun, knowledgeable, and we will see people in the future. Hopefully, it's been a while we haven't done an episode.
Yes,
so
I know.
near future now. That would bring.
Now with the new space we're shooting, I think we're gonna do more episodes, and I hope all viewers would share these videos with other viewers, subscribe to the channel, and we'll catch you in more exciting episodes in the future. Thank you.
Perfect. Thank you, Labib. See you guys soon.
See you.